St. Lucians experiencing breathing difficulty may be affected by dense clouds of reddish-yellow mineral dust from the Sahara Desert, health officials warn. This dust can worsen respiratory conditions, particularly for those with pre-existing issues.
CAFA and other regional organizations have issued alerts, and our ministry, through the Office of the Chief Medical Officer, has also issued alerts about the impacts, the negative impacts of the Saharan dust, and we are hoping that individuals, especially those with compromised immune systems and those who are prone to respiratory diseases and respiratory illnesses should take extra precaution.
St. Lucia's Ministry of Health and Wellness warns of rising cases of RSV, COVID-19, and the flu impacting productivity, according to Health Minister Moses Jean-Baptiste.
In the last couple of weeks, we noticed a slight decline in the number of individuals who are presenting at the health and wellness centers and also at our hospitals. However, we cannot take comfort in that. We know that over the last few months, a number of individuals have come down with respiratory diseases, can't go to work, they're sick at home and so on, and we continue to advise everyone to take the necessary precautions.
Face masks are encouraged, especially when visiting the elderly, sick, and those with pre-existing medical conditions.
We are increasing our public education, we are increasing our awareness activities so that individuals can be more cautious. We think also that the precautions at the health and wellness centers, the precautions at the hospitals are very important. We noted that the hospitals and also the health and wellness centers have been requiring individuals to wear masks and requiring especially individuals who present with respiratory symptoms, coughs and that kind of thing to wear masks. But the government has not considered any new measures in response to the rise in respiratory illnesses.
The health minister urges vigilance against the confluence of environmental attacks on respiratory health.
Elderly individuals, people who are not too well, but it is having an impact. A number of individuals who are presented at the health and wellness centers, our medical professionals are connecting their conditions to the effects of the Saharan dust. So yes, it is an issue, and we continue to advise the population to be careful.
The Caribbean Public Health Agency CAFA is advising people in the Caribbean to take precautions against the health impacts of Saharan dust covering the region. A dust plume worsens air quality and raises particulate levels, which can be hazardous, especially for vulnerable groups like children, older adults, and those with lung conditions. CAFA recommends staying indoors when possible, wearing a dust mask outside, using HEPA air filters indoors, carrying and using medications for lung conditions as prescribed, and seeking medical advice at the first signs of breathing difficulty. Milder symptoms may be alleviated with standard allergy medications. Solange Alfred, HTS News Force.